Today, we will be going over our interview we had with our retired OBGYN, Dr. Janice Wilbur, whom retired in 2019. I first asked Dr. Wilbur what was her undergrad major. She stated it was zoology due to the fact her college did recently divided biology into two sections, zoology and botany. Secondly, I asked her what med school did she attend. It was Ohio State. She did share with us that state medical schools are a little bit easier to get in. And foreign medical school, if you don't get accepted into a state medical school, you would typically go to a foreign medical school, and those are sometimes frowned upon. My next question with her was how did she manage her goals? She did share with us that it was difficult to manage her goals, but quote unquote, per Dr. Janice Wilbur, she just had to suck it up and do whatever needs to be done. At the beginning, whenever she went to medical school, she wanted to be an obstetrician. She wanted to help women feel comfortable in their bodies. But while she was in medical school doing rotation, she fell in love with how much OBGYNs got to spend in the office and also had to do a little bit of surgical time. So she liked to be hands-on and had a little bit of peace and quiet as well.
I asked her what her favorite part of her job was, and she said that her favorite part was surgery as long as everything goes well, because there really is a flow to it, and you really lose track of time, and how your knowledge and what you have learned come together to fix this problem. I then asked her how many hours she worked in a week and how many hours she worked in a day, and she said that she worked 80 hours a week and about 24 to 30 hours in a shift, and that it was very demanding and that she didn't have much time to sit. And if she was on call, she could sleep at the hospital. I asked her how has her career affected her retirement, and she said that she really, really loved her career, and even though she did really love it, she wanted to retire early because it was really, really demanding. And so, by living under her means with her partner, they were financially stable enough for her to retire at 50 years old. I then asked her if she saw a lot of patients in a day or very few, and she said that she saw a lot of patients in a day. She saw about 15 to 20 patients per day, and for new patients, they were allotted about 20 minutes per session, per appointment, and for returning patients, about 10 minutes.
When asked what part of your job you would like to change, Dr. Wilbur said she would like to change that in recent years, physicians and surgeons have had to learn new abilities, such as coding, and are now responsible for unassisted clinical notes, as well as other administrative responsibilities. When asked, did you always see yourself doing the career you chose? Dr. Wilbur said she did not always know she would be an obstetrician gynecologist, similar to most students who do not come to this conclusion until the end of their residencies. When asked, what is something you struggled with professionally? Dr. Wilbur responded that the hardest thing for her was to come to terms with the fact that medicine is risky, and there are uncontrollable aspects not only in pregnancies but in surgeries, and as a surgeon you must bear all these responsibilities. When asked what she would say to a freshman student pursuing pre-med, Dr. Wilbur said she would want whoever is pursuing this field to know deep down that they are meant to be here, by taking volunteer and shadowing opportunities and making sure they get lots of hands-on experience. This concludes our presentation on Dr. Wilbur. Thank you so much for watching.